Hello and welcome back to the Quantum Connection podcast and also Enlightened Mood YouTube channel. If you're watching the video, we have an extraordinary guest today, but Sarah Turner. I think you're a doctor. So, so much experience, wisdom, and entrepreneurial, right? Also experience. And she is the owner of a company named Cerathrive. Her history is very rich with a neuroscience background, as well as nutrition background. And now she is heavily invested in many ways in the red light therapy or photobiomodulation area. And so we're super excited to dive into that today with you, Sarah. And thank you so much for coming on the show today.
Yeah, thank you. It's such a pleasure.
So to get us started, I know you have such a deep history. I mean, there's so many areas you did a deep dive, right, in your early years and working for pharma, big pharma, as I call it. I don't want to get political, but right, there's a lot there. And I'm sure you have all kinds of interesting insight into that. And then your journey there's all these steps that you had taken. So would you mind just giving us like a short overview of your journey and what brought you into the business that you're in now?
Sure, yeah, and you're right. I started off in big pharma for a variety of pharmaceutical companies, but mainly GlaxoSmithKline.
Okay.
And there I was on a task force for the majority of my time there, kind of a problem-solving task force. Mm-hmm. And it was inhaled products is the main department that I was in. And I think maybe one of the turning points for me was that I was involved in a project looking at why some of the devices were working and some weren't. And we found out it was to do with the plastics. Actually, there was an effect of static charge on the body. So I had a great few months, kind of geared up to all of these different earthing machines or wearing rubber boots or trying to get charge into my body. And I think it was quite interesting to discover that the charge that you carry in your body greatly affects the efficacy of these medicines, mainly because it affects the functioning of the lung and where the fine particle fractions will deposit, which is mainly, what they're looking for with asthma drugs. Wow. And of course, the solution for the pharmaceutical company was to change the plastic. But for me, it got me thinking of, okay, what would be the solution, from a human level? And basically, it's grounding,
Yes. Yes. That's so amazing.
It was very interesting. And it kind of got me thinking, well, there's so much that could be done with our bodies to kind of help us live more optimally.
Totally right. And we don't normally think of ourselves as electromagnetic beings. And that's the whole point of quantum biology, right? Is to help people understand that. And then when you were talking about the plastic, it made me think of synthetic clothing, to be honest, and how when you wash it, it gets that static, right? As well as when you have the balloon and how you rub it on your head and or that you touch something and you get shocked. But really it's you interacting with that other, whatever that other thing is. I'm sorry, Vanessa, what were you going to say?
No, I was going to say, so if we increase the electric potential in our body by going outside and grounding, the medicines that we choose to engage with are going to have a better impact on our body. Is basically what that made me think of. So, if you're deciding to use a pharmaceutical, it's going to work better if you are grounded, if you are using circadian biology, if you're doing all those things and you're increasing the energetic potential in your body, that medicine should work differently in the body than if you weren't. That was my thoughts.
Exactly right, because you're going to get it right down into the bottom of your lung. Something that I've thought about a lot since is grounding in cities, because, people on bus routes in London have found out to be a lot more susceptible to things like neurodegeneration. And they think one of the main causes is the fine particulates coming from all the diesel and all the exhaust fumes from cars. So grounding, great in the countryside, not so great in the city. So again, this is some of the nuances of biohacking. We tend to have like a blanket, okay, everybody needs to be out there grounding, but actually you need to think about your environment, because it's probably not so clever to do it if you're on, like one of those, big bus lanes in any major city, because you're enabling your body to work more optimal. You're going to get all that fine particle down into the lower part of your lung. It's not always what you want if it's something that's, potentially not beneficial for your health. So again, it's all about
context.
Yeah, it's about context and looking at your environment. Where are you? And again, grounding. People say to me in London, where's best to ground? And actually, there's not very many places in London you can ground where the tube isn't under you, right? Or, so you need to be aware of your environment and what's going on, because it's grounding. Yeah, you need to get rid of that charge, but maybe there's a way to do it where you're not kind of standing over a power line or, next to a major transport lane.
Right.
Yes,
There's
100%.
a whole science behind that, and educational piece that needs to happen, so we aren't actually making people worse.
Yes.
Right.
Yeah.
So I love learning about your history and how, like a lot of us, we end up going into nutrition first, and you did that as well. That's
yeah.
almost like the segue or the portal right into the other aspects, like quantum health. But I mean, that's sort of the end right now, right? And so this is what happened for you, and then one thing led to another for you.
Yeah, certainly. And at that time, there wasn't these courses and things that you can get in quantum biology. In fact, nobody was really talking about it. And nutritional therapy was a thing, and it was, to me, it's like, okay, this is something that we can actually do for ourselves. And actually, I don't think I use much of that nutrition degree now, because so much of the quantum biology has kind of changed my thinking around that. But it's certainly a good because it helps you to understand things that you can do for yourself to change your biology, to optimize your environment. But the whole nutrition thing is now so contentious, isn't it? I don't know how you feel about it, but it seems to be so individualized. Everybody's got a different opinion. It really doesn't matter what you eat. Someone's got something to say that's right. Different. And so I think that's become a much more personal thing, and something where people have gone into this whole individualized medicine, where you need to understand your own body, because definitely not one nutrition plan fits all.
No, the one thing I do love about quantum biology is we do have some basic principles to work from. Yeah. Right. So eating with locally and in season, right. Yeah. And then the timing of what you eat. So that's really helpful. Stacking up from there could definitely be so individualized. Yeah, absolutely. So you were in nutrition, and then you went in, what was your next phase?
So, yeah, I was doing nutrition for a while, and I did become aware of the limitations. Mainly for me, it was a limitation around people's psychology, because a lot of time, people had other things going on in their life which potentially were more impactful, but didn't really want to go there with a nutritionist, and so I actually did a neuroscience master's degree, because to me, it's like, okay, it's all about the brain. And so that was very interesting. I went off to Roehampton, actually, in London, and did a neuroscience qualification. And at the same time, I started a position looking at informationally imprinted remedies. So really quite far. Yeah, a little bit woo-woo, that kind of.
I've never heard of that. What is that about?
Well, have you heard of Emoto? You've probably heard of like Emoto, when he does his thing where he's imprinting different sounds, or there's people, even I suppose bordering on homeopathy, this concept that you can imprint an information field onto a base, like a water or a mineral solution or ethanol. And to me, it was a very interesting time, because I was trying to work out what was going on with some of these things. And in my case, I was working for a company that had made a quantum consciousness interface device, kind of very, very esoteric, but it was all about the power of your intention to maybe influence things like machines.
And that was with a random generated, what was it called?
Yeah, they used a random event generator inside the computer. Yeah, to see if you could skew the randomness of the event generator. And actually, this was based on science. This was based on science from Princeton many years before, where they'd used a huge wall full of colored ping pong balls to see whether or not you could focus on the ping pong balls going in a certain ordered fashion. So, this was like the 1950s style random event generator. This was like a physical machine that they built, but actually it was done, the researcher's name, that they actually did get some interesting results. There was, over many iterations, a significant difference between intentionally focusing on something and not. So this kind of took me down this whole rabbit hole of what is consciousness, what is intention, can you focus intention, can you print information structures onto water? And very interesting, but right now we just don't, it's kind of a little bit beyond our measurement. And so definitely fringe science, but nevertheless, it brings up all kinds of interesting concepts like what is placebo, you know?
Mm-hmm.
If it's just placebo, what's the placebo effect? What is the power of our intentions? What actually is consciousness? You know, there are so many questions that spring off from that. Not necessarily, you know, even after 10 years of doing that, I was able to answer those questions. But certainly it's a very interesting place to go and put your brain for a period of time.
Mm-hmm.
And I went all over the world, you know, with people who were doing some very interesting studies, you know, seeing if you could change the pH of water. You know, William Tiller did some interesting stuff on that, looking at if you could interact with plants, and Heart Math were doing some fascinating stuff, recording electromagnetic fields and trees. And so, yeah, there's a lot of stuff. Lynn McTaggart did the field. I don't know if you remember all that stuff.
Yes.
Very, very interesting. But ultimately, because it couldn't be measured, you know, it's difficult to get anywhere scientifically with that. And in the end, I ended up in California doing this research, and I'd already been doing some stuff on quantum fields in water, because I was talking to people like Mei-Wan Ho, who wrote.
Yes.
Yeah, I was lucky enough to interview her. She actually lived in North London, and I was lucky to interview her about what she was doing. And then, of course, Jerry Pollock wrote his book on fourth phase water. And so then I started to get involved more in that kind of field of looking at structured water, informationally structured water. And of course, the thing that structures it the most is light. And that got me thinking, okay, if we can structure water with light, we can probably structure something like the brain, because the brain is mainly water. And really, that was probably 5 years ago. And ever since then, my main focus has been looking at light therapies for the brain, because it's a good mix between something which is still a little bit esoteric, because we don't really know what light is, really. But at the same time, it's measurable. We can get clinical evidence. There is a lot of people doing it. There's a lot of very serious scientists who are looking at it and publishing. You know, all the time there's more data being published on the effect of light on the body. And so really, I'm kind of in my happy place now, which is, you know, this medium between, you know, the hard science, but also for some exploratory stuff that still leads you down the whole quantum biology consciousness route.
Yeah, I love how all those threads kind of are weaving together for a beautiful tapestry for you. We're in the confluence of all the ideas and the research and experience, creating this beautiful experience you have now with being able to bring something forward to people who desperately need, and the ones who are interested in alternatives to, say, only medication, for example, for Parkinson's and whatnot. Yeah. I'm not sure how much you're looking into other types of things like, you know, depression and whatnot, but I'd be interested to hear about that. But yeah, I love your enthusiasm, because I can just see how you light up when you're like, I want to bring together. That's kind of what I like to do. It's like, I don't want to have to be pigeonholed in only this place. Like, I want to see the big picture, and I want to sort of bring all the threads together. It gets to be unwieldy, but I love how much you've just embraced that and just went all over the world, and you've participated in making movies, and it's very, very yummy. So
yes. Yeah, for sure. It's great. And that, you know, there's a huge range of people tackling things from different avenues. And I think that's something now in science, we're beginning to see this interdisciplinary approach, certainly in quantum biology, because before that, you know, before kind of the dawn of quantum biology, you know, the physicists and the biologists weren't talking. Right. Now people are starting to get that you do need to, everyone needs to pitch in. Otherwise, we're never going to understand it. It's like the story of the blind man and the elephant, and unless we kind of all pitch in a little bit, we're just coming from our own isolated parts. And
well, that's how the magic happens, right? Because then you'll see things that because we're blinded sort of by our specialty, I think, sometimes.
That's right.
So then it opens up, right, the opportunity. So you're Vanessa, let me see what you want to ask there. I'm just like,
my dog was barking like crazy, so I had to mute myself, and then I missed a lot of what you guys were saying. There was something walking by, so I apologize if on the video you see me trying to shush him. But I was really interested in what you were saying about water, because I don't know if you know that Heather and I are both classical homeopaths as well. So it definitely, you know, I believe that that's how homeopathy works. Like the energy imprints on the water, right? And then, you know, then it imprints into the body, and it moves through the easy water. I mean, that's my own beliefs of how it works. But I also wanted to ask you if you looked into Veda Austin's work as well, because that also is the same thing. You're putting a thought into the water. She has this technique where you put a thought, or you imprint a thought or an idea into water, and then you freeze it, and then you eat that water, and then that idea like imprints into your body, which I think is just so amazing. And there's been like many testimonials, and even with homeopathic remedies, I've seen her take the remedies and then freeze it. So she did say, I don't know, say arnica, right? She freezes it, and then you see the imprint in the water, like the image looks like the arnica plant or something like that. So I just think that's like so amazing to see. So I don't know if you looked into that, because I mean, you did May One Ho, and you were Jerry Pollack, and all these like amazing people that you've gotten to speak with and interview and meet and get all that knowledge from them, and that's amazing. So I just was wondering if you know anything about her work as well.
I don't know about her work, but I did also, when I was kind of like doing that interviewing period, I met Luc Montagnier, who was actually a Nobel Prize winner. He discovered he linked the AIDS virus and HIV, so he's really up there as a very prestigious scientist. But he did some fascinating experiments looking at DNA and electromagnetic signatures of DNA, and how you could potentially have that signature contained purely in the electromagnetic output from the DNA. So he did some very interesting experiments where he got base pairs of DNA, and he had a strand of DNA, and he was able to assemble a similar DNA strand just from the base pairs from.
Wow.
The experiment was called teleporting. That's how they promoted it in New Scientist. But really, he was just translating the electromagnetic signal. And I think for a lot of people, that validated some of these concepts of how potentially that imprinting into water might work. Because we know that everything is charged, life is charged, and you can maybe now, because we know how water structures itself when it's next to a membrane, potentially you could kind of make an imprint of this charge, because water could mirror the charges that you see on these things, like, for example, arnica. It kind of gives you a way to think, oh yeah, that is possible. That is how that might happen. So although I haven't really looked at homeopathy and I don't know this person, I definitely can see how this new research kind of opens up avenues to research that. And I'm sure that they will find that there is some way that we have that. Of course, there is some way that we're imprinting these different kind of substances. So yeah, it's very interesting. And I think a lot of people are now looking at the whole thing about quantum coherent domains in water and all this other stuff that maybe May Wan Ho and Emilio de Chudache were talking about a long time ago, but we need to kind of keep going with the data and until we find something. Everything is, what's the quote? Everything is magic until we work out how it's done, and then it's science,
Yep.
So yeah, it's fascinating for sure.
So
yeah,
Sarah,
I love that quote.
what is your current, what research are you doing currently, or studies, or are you?
So yeah, as you mentioned, I've now set up a company called Cerathrive, because I really wanted to make the best red light therapy device for brain function. That was kind of my mission. And it's been a bit of a bumpy road because, business is a little bit like that, but I'm kind of coming to the end of that. So I'm at a stage now where I need to get clinical data to kind of validate what I'm doing. So my main research at the moment is small scale trials, setting up. Eventually, I'd like to do neurodegeneration as my main trial, but I'm a little bit on a shoestring at the moment, so it's baby steps. So I've just been to Durham University. We're doing a trial on pain and fibromyalgia. I've just been to the Matter Research Institute in Australia, and we're going to be looking at concussive injury for sportsmen over there. So I'm really
like traumatic brain injury.
Yeah, traumatic brain injury. Yeah, traumatic brain injury and concussions. They also are worried about CTE, but it's kind of not so easy to diagnose. But that there is a big issue with sports people having CTE, which is a neurodegeneration-like condition due to possibly repetitive concussions.
I see.
So if there's a way to try and improve at least the symptoms of that, that's something that a lot of sports people are interested in doing. And the study in Australia is looking at that with a few other red light therapy devices to see what is the effect on certain symptoms which are indicative of that condition.
So it's like they're going to use your product and then other companies as well to see the different. Oh, that's really interesting.
They're not
Oh,
looking
yeah.
essentially to see the differences. They're just looking to see, okay, what has an effect. So it's not necessarily a comparison study,
Right.
although it depends how it gets reported, but it is just looking to see, okay, we have got quite a few technologies now that utilize light therapy in several different ways, because everyone's coming at it from their own little, everyone's got their pet wavelength, everyone is doing pulsing or not pulsing. Mine has got like a gut panel to go with a headband, so that's my unique take. So everyone's trying to find ways to maximize the therapy. At the moment, we just don't, we don't know what is the best therapy and the best dose and the best wavelength for each of the different conditions.
Right. So there's
I
definitely
like
some
your idea.
subtlety there. Sorry.
No, I love the idea of using the gut and the brain together, because we know that gut brain axis is so huge. So I thought that was really a unique take on it. I thought that was an excellent way to do it, because you're affecting both the two main critical areas, I feel like, to really, to support health. So
I think so. And, I'm basing it on, there's animal data out there to suggest, certainly with something like a mouse model of Alzheimer's, there are studies to show if you shine light on the brain, you have an effect. If you shine light on the gut, you have an effect. If you do both at the same time, you have a greater effect, because there seems to be some synergistic effect of targeting both of these things at the same time. So I definitely think targeting the gut is a good way to go. And more, every time you go on LinkedIn or every time you go on like PubMed, you see a new article that's linking another condition to starting in the gut. I think Parkinson's is very well established, but now people are looking at autistic spectrum disorder, even addictive personality disorder, some depressive disorders. So people are beginning to make that gut connection. And of course, the whole thing about the microbiome, again, that's an exploding field where more and more data is coming out about the different microbiome profiles that are associated with all these mental disorders. So from my point of view, it definitely can't hurt to target the gut at the same time as you're getting to the brain.
Right. So your Cerathrive has what you did apply it to Parkinson's and you did have a positive outcome. Is that right? Or was that something else? I'm getting confused.
Yeah, I haven't. For the device that I've got, it's all based on research.
Okay.
So it's based on research that's currently out there and published. So for example, like with the Parkinson's, my device has a similar output and wavelength to the device that had a positive result for Parkinson's. And eventually my goal is to do a study. Okay. But I was kind of involved in the data collection on some of these trials. So I got to kind of see how the device was working, what was good and what wasn't good. So I'm hoping that I can bring a little bit of that. But yeah, what we really need in the industry as a whole is more research on the different wavelengths, the different pulsing schedules, the different dosages, because at the moment everyone's just doing what suits them. And then it's very difficult to compare across studies, because if the wavelengths are different, that could be why one device is working and one isn't. So we are in a bit of a development time for all of these neurotechnologies, where we need to maybe standardize the output so that we can start to compare things a little bit better.
Yeah, that makes so much sense, because, light is a nutrient, and you think about, I don't consider medications nutrients, but there's the dosages and the frequency and right. What are the side effects, good and bad, right? And so when you're using photobiomodulation, it's the same idea. We have the different frequencies. You've built several into your product, and each of those could be having a certain impact. And then what's the cumulative impact of all of them synergistically? So there's a lot of things happening, right?
Yeah, there's a lot of things, and there's so many permutations that people are using. It's very difficult to know what is having the effect. Someone can be using a pulse rate of 40 hertz, but a low, like a low dose, and getting an effect. And someone can be using a high dose, but no pulsing. So then we don't quite know, what's having the effect there. Is it just getting photons to the brain, or is it more about entraining the brain waves? Right. So I think there are so many permutations, and we don't have, a body really that's kind of regulating this, although there is a group at Shepherd University in the States that's looking to at least standardize the dosing. I think that when we get there, then the whole industry will kind of make a huge leap, because we will be able to compare this data and say, okay, we've worked out that, you know, this is the optimum dose, at least for this condition. Yeah.
Right. Because I feel like there's so much amazing research on red light therapy. Like, it's huge, right? There's so much amazing research on the benefits of red light therapy for so many different diseases and inflammation and all kinds of things, right? On the effects on the mitochondria, the easy water, like all the things.
Yeah.
And it's like, it's not really like mainstreamly known. And like, I wonder, like, what's the cause of that now? Do you think it's because of these nuances here? You know, why is this not a like mainstream thing that people can go to and use yet? You know, because it's just, there is so much data on it and so much research that proves that it is effective. And, you know, it's a safe option because there's really not a negative usually side effect of it. I mean, that you would see also, I would think. So it's like a really safe option for people to go to in the beginning, you know?
Yeah, I think the main barrier at the moment is just getting the resources to get the full testing. And America is leading the way with this. You know, there is a lot of research going on in America. There's a lot of research in the Veterans Association, and certain companies are looking to get to the stage where they can present clinical data to the FDA. And once that happens, then there'll be a category within the FDA for red light as a therapy for brain health. And then it can start, you know, getting into the clinics and getting into the hospitals. And once people can see it working, I think then there'll be a huge cascade effect. We're just kind of not quite at that tipping point yet where there's enough clinical data, because it's very, very expensive to do clinical data in human trials. And there are a lot of hurdles to get there. And there's a lot of resistance to that. You know, it's something that's not taught in mainstream medicine. It's not something that's really taught in any kind of biology course. And so, you know, that people are suspicious of it. And, you know, we've kind of got a little way to go with the education piece to get people to understand the effect of light. I mean, people don't even really understand the effect of their light bulbs in their house, you know,
Right.
let alone this red light device. So I think really it's a case of education, and then basically getting the funds to do the clinical trials. Once we get there and it starts to be utilized, then I think people will start to see where there's these huge advantages, because, you know, certainly for a lot of mental conditions, there is no drug therapy, or at least no really effective drug therapy. There's a huge need there, and that will drive the clinical research, because, you know, where there's a huge need and there's no other option, there's no pharmaceutical intervention, then of course it will start to be looked at. So I'm hugely hopeful. I know that there's a company in the States that's looking at autistic spectrum disorder, you know, and perhaps they will get to the stage of having clinical data soon, and then we'll get information. Yeah,
I hope so, because it's just like we can really change a lot if we just change our light environment.
yes.
We could change, like, do so much good in the world. Like, and you know, it's hard. Like, you know, I'm just an average person, right? You know what I mean? But like trying, like, I don't have all this research and data. So it's so nice to have people like you who can bring this research, this data, and share it with the world. Because when I say, you know, the blue light from your LEDs is bad for you, people are like, that crazy lady. But like, you know what I mean? Like, but it is research behind that shows it. And I say, when you should use red light or something like that, like, it's, the research is there. But yeah, hopefully, I think it's going to take a lot of years. I mean, I don't know what you think, but hopefully in my lifetime it'll be more mainstream. You know, that's what I'm hoping.
Well, do you know, people still call me the crazy lady, and I've probably got at my fingertips, like, you know, like 1,000 studies I could kind of throw at these people.
Right.
Because I think people don't, you know, people are not quite there yet. And also it's a difficult sell, because people are addicted to their technologies. People want to be in their comfy houses. You know, it's something where you have to change your mindset, and it's not intuitive for a lot of people, because we are a little bit disconnected from our light environment, you know, and to start saying, okay, you know, did you know, you shouldn't be looking at screens at night, you know, it's kind of, it's not a message that people necessarily want to hear. But actually things like I was at Professor Paul Chazot is a great guy at Durham University, and he was telling me about, he got an arts fund to change the lighting in the nurse quarters of a hospital. He couldn't do the patient because that was too clinical, but he was able to do the nurses' quarters, and had some fabulous results just on general well-being, on sleep, on ability to deal with stress. Yeah. So things like that, I think people need to experience it probably, you know, and that's where, you know, people like yourselves come in, where you're kind of telling people every time people hear it, you've got your blue blockers on, you're doing the whole light thing, then people start to understand the effect of light. And then it's not so much of a leap to understand, okay, you can change, your biology by kind of giving very targeted wavelengths at certain times. I think it's just that education piece. We need to kind of come out of this indoor lifestyle a bit, or at least get a little bit more savvy about our light environment generally. And then maybe people understand that the medical use a little bit more.
Yeah, that's how we have this podcast. And that's why we have people like you coming on.
That's
to
what we're all doing. We're trying to get information out for sure.
Yeah. So it's just an ongoing process. Do you happen to have one of your devices with you, Sarah?
I've got one
I'd
down
love
here.
to see it.
I'm hoping that it might not be charged, because I can say I'm kind of a little bit on the road right now. I've done like 4 countries in 3 weeks, I think.
Wow.
Let's see if this one is on. Okay, so this is the headband.
Okay.
So you can see there that it's got red. You can actually see the red. And I don't know whether the computer allows you to see a little bit of the near infrared. You might see it as kind of purple in there, or you might not. But that's got 4 wavelengths of red and near infrared. It's got one that goes on for the cerebellum. And this is specifically designed so that, we can target different areas of the prefrontal cortex. We can also oscillate the light, which is also called pulsing. Sometimes you can pulse the light at different frequencies.
So that's just to the strength of it changing, or can you break that down for me? The pulsing aspect
is the rate that you turn the light source on and off, in effect.
So it's not flicker.
Well, flicker is also some form of oscillation, but flicker is usually something that's a kind of a very high hertz rate, which is a little bit like irritating to us. And like, you have flicker in these fluorescent bulbs. Flicker or pulsing that you use in these light therapy devices is usually something that's used to entrain a certain brainwave.
Okay.
So our brains are oscillating all the time at different frequencies, depending on what we're doing. If we're in an attentive state, if we're meditating, if we're just kind of daydreaming. And so what we found during research is that if you oscillate, say at 10 hertz, which is a fairly slow oscillation, it's called an alpha frequency, that has a specific effect on the brain. So we can do that with the light. You can do it with any kind of electromagnetic field, but we're doing it with the light in this device.
Cool.
So in this device, we've got 7.8, which is a Schumann frequency, 10, 40, which is a gamma, and then 100 hertz, which is kind of normally seen as above what our brain can really understand, but it seems to be something that's useful in meditation. And I got that actually from data on ultrasound. So this one is not so much tested in a light therapy device. So again, this needs to go off to a meditator group to see if that does have an effect. I know there's another company called V-Light that also makes a transcranial device, and they've shown some interesting effects of these higher oscillations. So they've looked at 100 and 200.
Well, that's the need for different testing groups, right?
Yeah.
And so looking at different outcomes. Okay.
Exactly. And it depends what you're trying to do. Because if you want to meditate, that's very different to somebody who maybe wants to focus. It's 2 different things, 2 different mental states. And so we don't know yet. Maybe one wavelength would be more suitable because, at the moment, most of the testing is done on 1 wavelength. I've got 4 wavelengths because I want to try and make sure I hit any potential light receivers in the brain, including water. Because that was originally where my research was coming from. So water will be a chromophore above 900 nanometers.
And chromophore, just for audience, if you could define that word.
So chromophore is just like a light receiver.
Okay.
So water will receive and absorb light at a long wavelength. So when I say above 900, again, that might not mean anything, but that's a long wavelength of light, because the longer the wavelength, potentially the deeper it penetrates, but also the more the water will absorb that wavelength.
Okay.
So my idea is let's let the water absorb it and potentially structure the water, and that could have beneficial effects on things like protein folding, because we know protein folding, proteins are all hydrated and they all fold according to their charge. If they're not hydrated correctly, then you get protein misfolding, which is, you definitely don't want brain. So my idea is to use these wavelengths that people routinely use, like the 850, which is still near infrared. It's still not visible red. It's still long wavelength, but also use the longer ones too, so that you're kind of maximizing your potential to have a therapeutic effect.
Because it's going to, you're targeting the water, and then there's obviously the mitochondria. And there's another one, what was the other one you mentioned before?
The blood too, because 600, which is visible red, that it doesn't actually penetrate to the brain, but you are getting all the blood around the brain. And you can see this is the body pad.
Oh, that goes on your stomach?
This goes across the abdomen. This one has half red and half near infrared, because then you're really kind of irradiating the blood. And all that blood that kind of goes past your belly is going to get into your brain sooner or later. You know, your body's constantly pumping this blood around. And we know since 2019, we've known about free-floating mitochondria, and that mitochondria are not just bound in the cell, they are actually also in the blood and will go to where they're needed for repair.
Wow.
So you're irradiating those mitochondria and kind of making them more efficient, you know, sooner or later that blood could end up in your brain. And that could be part of the therapeutic effect. Like I say, there are so many pieces to the therapy effect on the brain. My idea is, okay, let's try and target them all and maximize the effect. And of course, you know, if we work out one has more effect on the other, we can focus on that. But right now, my goal is just to maximize our potential to heal our brains. And so let's do it. You know, it's very simple to just put red light on your abdomen for 10 minutes a day, you know, red and near infrared. We already know that it's good for pain relief and wound healing and increased blood flow. Let's see what effect that has also on our brain health.
Yes, absolutely. Because that's harder to kind of get to. So I like you know, you've put a lot of thought into how to get the red light frequencies in there where it's easier on the gut. So now how does this work? So somebody puts it on and then they just do it for an indicated period of time, and then 3 times a week, or what's the protocol?
Yeah, the protocol is, it depends kind of where you're starting from, because the kind of the more depleted your mitochondria are, the less light you can take.
Right.
So, you know, somebody who's, you know, their redox potential is great and their mitochondria is humming along, you know, they can probably do it every day because they're ready to receive that light. But for people who have maybe got a chronic health condition, probably 3 times a week is enough. And, you know, for some people, they may need to even titrate that down, because it's like exercise, you know. If you're very fit, you can go to the gym for an hour and lift weights and you're fine. If you haven't done anything for years and, you know, you're a little bit out of shape, you're really going to feel it if you go to the gym for an hour. It's a similar thing, because your body will adapt to things like the light. The mitochondria, those organelles, are mainly where you receive the light. So the more you shine light onto them, the more that they will replicate, and the more that they will kind of have those enzymes that are ready to receive the light. So it's about a cumulative effect. It's about building up slowly and going from where you're at. But mainly for these devices, they're fairly low power compared to things like lasers. So they're very safe to use at home. It's difficult to overdo it. But for most people, between 3 and 5 times a week for 10 minutes, that's the dosing. And that should, over, you know, a period of like between 3 and 4 months, should start to give that therapeutic effect.
Right, because we're working with our body's natural ability to heal itself. So it's not going to be this overnight thing. You know, it takes a little time, especially for those who are living a modern lifestyle where they're indoors most of the time. They have a toxic light environment. Their mitochondria are going to be compromised. The functionality, I mean, not necessarily for every single person, but depending on their, you know, their health in general. But that's the redox. Like, can your body create its own energy? How well does it utilize that energy? That's what you were mentioning. It's like you can't go run a marathon if you are out of shape. Your mitochondria can't absorb and utilize the red light. You let me know if I'm getting this right. If they're not very healthy, if they haven't been able to do what they need to do naturally with the right light inputs and getting out and grounding and all of those things. So yeah, I think that's my takeaway from what you're saying.
That's exactly right. And so, it's best, if possible, to do it as a program, and I'm sure all the things, the grounding, the getting enough sleep, the getting up at sunrise, the switching technology off at night. The more you can do to kind of, strengthen your body and your mitochondria, the better this, or any therapy really, is going to work. But yeah, certainly they call it like a hormetic stress, like hormesis, which just means like a low level stress makes you stronger. A little bit of stress helps the body to kind of learn, and that's the same with exercise, and it's the same with red light therapy. In English, maybe we call it preconditioning. You want to stress the body a little bit to come ready for the next day, so you do have a cumulative effect. And so people can build up light therapies. You maybe just do it once a week, then twice a week, then 3 times, until your body starts to respond.
So you use your own product, I'm assuming, yes?
Yeah, I use mine, and I tend to use it like in the evenings. I will put my gut pad on, and actually I find that because I'm doing things to try and assess, I've got speed reaction tests, I've got things like that for my brain, but actually the way I can really feel the gut panel, when as soon as I put that on, if you're a bit uncomfortable after eating or whatever it is, to me, that's kind of an instant, and oh, okay, I know this is working. And sometimes I have crazy dreams after wearing the device, and I think, okay, that's my body working through things. But yeah, I'm like, I've got loads of these laying around, so I just can use it as and when. But trying to like build up my own experience of things like the pulse, that's something that I'm now looking at. Okay, what if I just do like 100 hertz when I'm meditating every week? Can I see a difference? So that's
you can
kind
change the hertz on the device?
You can change it, yeah. So at the moment there are 6 programs.
Oh, okay.
Depending on what you want to do. So they're kind of intuitively called, one's called meditate, one's called peace, one's called resilience. So you can kind of select the one on an app. So it's all app controlled on the headband, and then which sends Bluetooth to the headband. And then when you put the headband on, there's a disable switch. So then there's no Bluetooth coming to and from.
Of course you did it like that.
Perfect. That was my question.
Yeah. So but you don't have to. You can do it without an app. You can just switch it on, but then you just get continuous wave. But if you want to do the pulsing schedules, there are 6 different schedules.
Okay.
And so they not only change the pulsing schedule, but they also sometimes change where the light is going in. But this is something that I've worked out with research, and it's something that I'll keep evolving. So, when people get the device, maybe there'll be new data out. Like, for example, there's new data coming out about depressive disorder that mainly going through the right hemisphere seems to be having an effect.
Oh, okay.
So I'll start to research that. If that proves out to be the case, then I can send an update on the app and we'll do some program that's just that. But at the moment, there are 6 programs that are set according to current research to give like the best therapeutic effect. And some of them pulse and some of them don't.
Wait, so you're saying that as the data emerges and what it shows is the better protocol, you can then update the app for someone who's maybe already using your device, and then it will adjust.
Yes. Yeah.
Wow, that is super cool. I love that.
That is cool.
So it's like in real time.
Yes, the update is called update over the air or something. So the engineers tell me there's a special name called update over the air. But anyway, that's how that works. But at the moment, the 6 programs that I've got in there are fairly comprehensive. And these are ones that, I've been testing on friends and family and are based on current research. So, some people we'll see, some people may favor some programs over the other. It really depends what you're trying to do. It's all about kind of setting your goal. And carrying on that attention for 3 months and seeing how that works, and then maybe trying something else. But I think the data is fairly conclusive for things like neurodegeneration seems to respond best to 40 hertz pulsing rate. Not that, like I say, this isn't a medical device, so I can't recommend anything for neurodegeneration, but that's what the data is showing. So
Yes, it's important how we say this. I understand. So
Yes.
the data is showing that it might have an application for Alzheimer's and Parkinson's and those other neurodegenerative conditions. Yes.
Yes, people are starting to research things like 40 hertz pulsing for those neurodegenerative conditions. Now, the symptoms of that is that people are able to focus more and concentrate. So we can say, for example, with this device, you can have improved focus, enhanced concentration, because they're wellness claims. But, I'm just taking the data. I mean, that's really what we want. If you have got some kind of brain condition, probably that, you need to be able to focus, you need to be able to attend more so you can remember more. All of these things are interconnected anyway. But for all of the devices that are on the market at the moment, none of the devices at the moment have got a health claim attached to them, because we still need the clinical data. However, you can take someone from a baseline of where they're at to better. That's really where all these wellness devices sit. So if you've got a poor memory, certainly you can use these devices to enhance your memory, for example.
Right. So we swing it that way. Yeah.
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 And
Exactly.
really that's what you're doing anyway with any kind of intervention, isn't it? You're going from where you're at to better. You're going from where you're at to improved. That's really all we can hope for. So I think it's fine to use that terminology. It's just in the research, they are looking at these specific conditions.
Right. Well, you have to target something.
Yeah.
I mean, something that you're trying to ameliorate. Yeah.
Yeah. So if you want to enhance your health, a red light therapy device can help in many ways. That way. Simple way to say it.
Is your device available right now, Sarah?
Oh, yeah.
It's available on pre-order right now at cerathrive.com. I'm almost there. The test batch is actually happening this week, so I'll find out on Friday if that's all gone to plan.
Nice.
I don't expect there to be any issues, and as long as that's happened, then it's another month, 1 month for full production, so it will be November. But like I said, at the moment I'm doing a special offer on pre-orders, because people may have to wait a little bit, and so people know where they're at with that. And then when we go to full production, then we'll be all ready to go. And there will be a little bit of a price difference, but not a huge amount. But yeah, certainly at the moment we're in the pre-order stage, and I'm kind of doing all the events. I'm getting ready for the Netherlands biohackers this weekend and things like that.
My goodness, you're traveling so much.
Yeah.
But it sounds like you're really enjoying yourself, right?
Yeah.
Well, this is what I love to do. I mean, it's so interesting field to be in, and also the potential to help people with brain issues. It's hugely gratifying, because there isn't another option.
Right.
So yeah, for me, it's a very interesting industry to be in, which is one, and also it's hugely satisfying to be able to be involved in helping kind of people with those kinds of conditions, because I think certainly in the West, that's where we're at. A lot of the conditions that people are facing is either aging and neurodegeneration, or it's stress and burnout and depression. It's such a huge thing, that to be able to kind of make even the smallest dent in that, that's
huge.
Be profound.
Yeah, it's a good feeling for sure.
Yeah, absolutely. Yeah.
So because I just am thinking there's so many, like the mental health field, there's such a dire need for some alternative to medication, in my opinion. It's just, we need the quantum biology aspect, and then for the targeted intervention with the red light therapy would be amazing, as for the more severe cases that aren't remediated by just quantum biology lifestyle changes. So I can just see that you're going to be very busy for so many years getting your message out. Your mission is right, it's so needed, and there's so many ways that your device can be used. So
yeah, and there are people blazing the way who are doing it already. There's a guy in Boston, Dr. Paolo Cassano, and he's been able to set up a research center where he's actually got a clinic for people with psychiatric conditions, and that's his focus there. And although he can't
look him up,
I would check it out, because he's doing some great work, and he's publishing a lot on major depressive disorder. I think he published recently on people with Down syndrome who had certain cognitive issues, all kinds of different things to do with mental health. And he's got a clinic there where people can actually go. Like I say, it's
Wow.
not a paying clinic because it's still purely research, but that's huge. That's huge that they're starting to get like things like clinics where people can go,
Absolutely.
by a psychiatrist or something, I presume. That's fabulous.
Mhm.
Yes, there are people definitely blazing the trail of looking at these kind of mental conditions and how can we provide an alternative to a pharmaceutical that probably isn't working, in some cases is more detrimental than not.
Yep.
Oh,
Exactly.
yes, that I agree with. Sarah, I want to ask you, so what is the difference between using, say, your device as opposed to like another red light panel, say, because red light panels are sold like all over. And I see the obvious difference in my mind is that yours is targeting, in the brain on, in this area to get it really deep into the brain and on the gut. And then it has the pulsing, which is different. So are those really the main differences between your device and, say, using a red light panel device that you get from somewhere else that just kind of shines those
Well, I think the main difference is dosing, because in order to have a dose of red light therapy, you kind of need to know not only what's coming out, but you need to know what's going in. And with the panel, it's difficult to know what's going in because, for a start, the distance that you are away from the light source, the dosing drops off hugely. Even a few centimeters can make a massive difference.
Okay.
And so if you're standing really close to a panel or a little bit away, or you're a little bit at an angle, you really don't know the dose that you're getting. And also, light does travel only in a straight line, so anything that's not off directly, on an angle with the light, it's either going to reflect or scatter or bounce. You're not going to get the light going into the body. So really, you need something that contours exactly to the body, fits flush to the body, so that you know the dose and you're getting the full dose. And then also, with most red light panels, they only go up to 850, whereas this device, like I say, it's got 4 wavelengths, including the longer wavelengths, which is 940 and 1070. So those you won't get in a panel. And then, of course, there's the oscillation. Now, I think some panels probably do have some kind of oscillation, but probably not enable you to kind of switch the oscillation and the wavelength and where it's going onto the brain. So I think the panels are good, but probably more for like a kind of overall wellness rather than a targeted therapy. I think that's probably the difference, really.
That makes sense. Now, is yours a
Very good. Thank you for
rechargeable, or
sharing.
how does the power work?
Yeah, it's rechargeable. So this is just a rechargeable battery, and there's one on the
Nice.
front here. They're double shielded, so there's no EMF
Perfect.
from them, but it makes it easy. I mean, these ones, I had them at a trade show at the Dave Asprey event, and we just charged them once and had them going all day.
Really?
And the
And you
headband.
were
last
booked
a long
solid.
time.
They were there all day. You had a lot of people, a lot of interest, right?
Yes, yeah, we were very busy, so we just were charging them overnight. So I know that they've got 10 hours or something. If you're using all the time, maybe we did charge them once in the middle of the day, but certainly you can get 10 sessions out of one.
That's a long time. Yeah, that's a long time without having to recharge.
Yeah, so you don't have to, and it's just a normal USB, USC. You don't have to have any kind of funky special charger. You can charge it. If you lose the charger, I'm sure people have got these hanging around. So it's very accessible, and from that point of view, you can kind of go around your day and do it. This whole thing about stacking your hacks. Because I think that's one of the things that stops people using these therapies is compliance. And if you have to go and sit in a corner next to a mains and you have to it's a thing, it's just another barrier to doing it. I mean, this panel, I just tuck it down the front of my yoga leggings and put the thing on, and I'm off, doing something else. And the other thing is, I think sometimes it's good to pair the therapy with the task that you want. So, for example, if you want to be able to concentrate, it's best to do the therapy while you're concentrating. It kind of reinforces the behavior. If you want to meditate better, it's best to do the therapy while you're meditating.
That makes
and
sense.
Actually, I've got a guy doing some meditation tracks that go along with the device. So in the app, you can also have a meditation track, which the frequency of the background of the meditation will match the oscillation of the light. So you're kind of getting it from all angles. But certainly I think there is a lot to this pairing things. I had one guy who's testing my device and he was all about balance. So he was doing it while he was kind of doing one of his experiments, standing on one leg. He'd actually had a bit of a fall and he was worried about not being so stable. And so he did a 10-week, Dr. Clifford Saunders, you can probably find him on LinkedIn. He kind of posted his whole protocol. But his idea was, okay, he's actually called the brain reprogramming doctor too, because this is his thing, how to reprogram your brain. So his thing is pair the task with what you're trying to do. You know, if you want to focus more, use the device while you're focusing. You know, if you want to balance, stand on one leg, you know, whatever it is. But I think for me, it's all about compliance and making it easy for people and accessible. And if, you know, if it keeps running out of charge, or if you have to go to a clinic or do something special, it's just another barrier. So this is just easy. Like I say, just tuck it down your yoga leggings and you're off. You know,
I love that. You can just do stuff around the house if you want to. Yeah.
Do your housework. You know. Start, you know,
because people don't want to stop with their lives to do things, you know. It's so common, you know.
Well, you don't have time.
It's hard to get people to even comply to like quantum biology principles because they want to, you know, they want to just live their lives, you know. So this is definitely a solution because you could be doing it and then doing whatever else you need to do, whether it's working online or whether it's, I don't know if you're going to, you know, maybe you could actually do yoga. I don't know, but like you can like, you know, go and like do things or, you know, while you're doing it. So
yeah, why not? Why not? Let's take away one less step towards compliance. And you're right, you know, it is hard. If we did everything that we were meant to do, you know, according to kind of all the quantum biology and biohacking thing, you know, you'd do nothing else in your day, would you? You know, sometimes I think, oh God, you know, I've got to ground and meditate, and then I've got to be in an ice bath, and you know, it's
too much.
It's a lot. So the more that you can combine these things, the more
you're stressing about getting the biohacking done. That's not really effective. No,
that's not where we want to be. Yeah.
No, not at all. Not at all. Yeah.
So we're almost out of time. I just want to say thank you so much, Sarah. And is there any last kind of enlightenment you can offer us about, you know, your product, red light therapy, where the trend is going, or what your hopes and dreams are for your business?
Yeah, well, like I say, my hopes and dreams are to make an impact into some of these conditions. And, you know, if I can kind of be involved even a little bit in some of the research into neurodegeneration, that's kind of where I'm putting my long-term goal. But as for kind of using the therapies, I mean, the stuff that you're doing is kind of the most brilliant thing, because it is all about education and self-experimentation. So if you haven't done these things, you know, get a red light therapy device. You know, it doesn't have to be my one, but, you know, try these devices and start to get that experience. Like I say, it really is something that is, you know, out of all the things, you know, if you think about sitting in an ice bath or all these crazy things, you know, this is not something that's too onerous. All you have to do is you're sitting down and using these red light therapy devices. And I think you don't really know how they work until you try it for yourself. So get some more information, kind of educate yourself. There's so much interesting stuff coming out at the moment. I'm giving a little talk in the Netherlands about photobiomics. You know,
what's that?
It's just about how red light affects the microbiome, and you know, just light over the gut could potentially have this effect on the microbiome. But people are starting to write about these things more. You know, there's papers available. So I think, you know, listen to your podcast, start using these devices, start doing these things a bit more, because really, you know, we have ourselves as these wonderful vessels where we can actually, it's all right to read it, but we can experience it. And I think that's,
well, the N1 testimonials are what are going to help get traction as the word spreads. And people say, well, this is what I used to help me overcome this or improve the symptoms of that condition, right? So we really are on the ground, right? We're the people bringing it out to the masses so that we can start to empower people more and more to take ownership of their health, not be scared to trust their bodies to heal, their capacity to heal, right? Understand more of their basic electromagnetic physiology, and then empower them to seek out resources that can help uplift them versus like, oh, I have to take this medication for the rest of my life. And now I have
Exactly.
these gnarly side effects. So I
Yeah.
don't feel like that's a very good option. And although I know it's easy and people are sort of trained that way, I mean, our mutual goal here is to start to shift, right, the
Yes.
paradigm, and help people to see that there's so much better options. There's so many better options out there.
Yeah, that's wonderful. Yeah, that's what it's all about, isn't it? It's self-responsibility and self-empowerment. You know, the more that we can take on ourselves for our own health, you know, ultimately the better we're going to be, and the better shape society is going to be in. You know,
Yes.
everybody can just take that little bit more responsibility. So thank you very much for this opportunity for talk about my device. It is fabulous. 10% off code for your listeners too.
Oh, well, thank you.
In case people
Yeah.
want to try the
much.
system, but yeah, what you're doing is brilliant too. So thank you. I'm very honored to be on your show.
Thank you so
Oh,
much,
thank you
Sarah.
so much. We really appreciate
Yeah.
it, Sarah. We love having people like you and her just trying to make a difference in the world. Yeah. So we really appreciate it. So it's been an honor, and thank you so much for that. And we will definitely share it with all of our clients and people and listeners, and hope that they get to try it. Maybe we'll get to try it one day in the future.
Yes.
Thank you
Yeah.
so much. It's such a
Yeah.
pleasure. Thank you.
Thanks.
All right, Sarah. Thank you. Bye.
Thank you. Bye.